All people deserve to enjoy health and well-being, no matter where they live. Yet, according to the World Health Organization, social determinants of health, the conditions in which people are born, grow, live, work, and age, are the greatest contributors to health inequities. Where you live greatly impacts health status. Detroit is no exception. The Detroit Community Academic Urban Research Center, known as the Detroit URC, is a partnership of academic researchers, community leaders, and health and human service providers who work together to address health inequities in Detroit. The Detroit URC was founded in 1995. Its work revolves around the simple but critical idea that the best way to address health inequities is for community leaders and academic researchers to work together in partnership on action-oriented participatory research designed to benefit the community. This approach is known as Community-Based Participatory Research, or CBPR. Dr. David Satcher, former director of the CDC, who was responsible for initiating the nationwide Urban Research Center program, has written about CBPR, saying, quote, "This research approach holds the promise of getting to the root cause of health disparities and of strategies for enhancing health, as well as the involvement of persons at every level of the community." Building on other similar approaches to research, Dr. Barbara Israel, director of the Detroit URC and professor of health behavior and health education at the University of Michigan School of Public Health, was one of the first to pioneer this approach in the early 1990s.
Doing community-based participatory research, I think more and more is becoming globally recognized as kind of the way to do certain types of research. Not all research, of course. The godmothers of CBPR are right in the Detroit URC. Barbara Israel, Amy Schultz, Edith Parker, all of these folks that have really laid the groundwork.
Initially, when we came into the city in 1995, the community partners were very skeptical about why is the University of Michigan in the city of Detroit? What do we plan to do? Can we be trusted? They were used to what some of our partners referred to as drive-by research.
For more than 2 decades, the Detroit URC has successfully brought community partners and academic researchers together to address public health challenges in Detroit. The work is done through multiple affiliated CBPR partnerships and focuses on 4 key areas. Basic research, to enhance understanding of issues related to social and environmental determinants of health. Intervention research, to implement and test the effectiveness of solutions to those health issues. Policy translation, to impact long-term policy change. And CBPR capacity building, to build capacity so others can carry out community-based participatory research. This video outlines some of what the Detroit URC and its affiliated partnerships have done and are doing in each of these areas, and how they are helping to improve the lives of people in Detroit and beyond. One of our partnerships, called Community Action Against Asthma, is examining effects of air quality on childhood asthma in Detroit. Another partnership, Racial and Ethnic Approaches to Community Health, is investigating and addressing the differences in the health status of racial and ethnic minorities in diabetes, high blood pressure, and other health complications. Community action to promote healthy environments builds on more than 15 years of CBPR conducted by Detroit URC-affiliated partnerships, as well as new research aimed at addressing issues of air pollution and health. Through these and other collaborative initiatives, the Detroit URC and affiliated partnerships have published extensively in peer-reviewed journals and made presentations at national meetings, always involving community and academic partners as equals. While research helps to better understand and address health inequities and related issues, another part of the Detroit URC's work helps to put research into action. The Healthy Environments Partnership conducted and evaluated a 3-year Walk Your Heart to Health intervention program.
The Walk Your Heart to Health program was really based on research. So it was researchers from the University of Michigan that came in to prove that walking works for Detroit. We've seen changes in people's blood pressure. Cholesterol numbers also were a positive change.
The great thing about walking is that it's a form of physical activity that almost anyone can do. You don't need a lot of equipment to do it. A good pair of walking shoes is pretty much what you need to have.
Another example is Community Action Against Asthma.
They do a lot of work with air quality, youth-related asthma. What CAAA has benefited from the URC is really being able to draw from the research.
This partnership carried out a trial involving 300 children with asthma, in which community health workers worked with families to identify and reduce environmental triggers of asthma. The result was improved lung function and frequency of coughs, reduced emergency room visits, reduced unscheduled medical visits, and reduced caregiver depressive symptoms. The Detroit URC trains community members in policy advocacy, helping empower them to pursue policy change related to health. Through in-depth trainings, Detroiters gain the skills to have an impact on organizational, local, state, regional, and national level policies.
More and more we've been working with community members to how do you understand a research finding and how do you translate that research finding and meet with city council, meet with state legislatures, meet with the federal staffers to really recommend and think about policy change to have a long-standing impact on health in the city of Detroit.
One Detroit community-based partner that has harnessed the power of policy know-how is the Detroit Hispanic Development Corporation.
We have a lot of industry that's kind of surrounded and intermixed with the residential areas. So the Ford Rouge plant, the steel mills, several of the affiliated, associated kind of businesses, the water treatment plant. So when you combine all of those things, air quality and health impacts in our community are pretty bad. Working with the Detroit URC over these years, particularly in Southwest Detroit, has had a really big impact on our ability to move policy and inform policymakers, particularly around environmental justice issues.
The Health Impact Assessment of Detroit is a multifaceted assessment of the city and its neighborhoods. The collaborative, evidence-based assessment explores how and to what degree proposed renewal strategies are expected to impact vulnerable populations in the city. The assessment will provide valuable information and insights for community residents, city government officials, planners, funders, developers, researchers, policymakers, community-based organizations, and advocates. It will help inform and guide decision-making in Detroit related to economic growth, land use, neighborhoods, city systems, and infrastructure. The Detroit URC is striving to expand the number and capacity of CBPR partnerships in the city. The center has established a community academic research network called CARNet, which serves as a CBPR networking forum. This network provides valuable opportunities for community-based organizations, health service providers, and academic researchers to start new partnerships. The Detroit URC provides technical assistance, small planning grants, and mentoring by community and academic partners. To further build CBPR capacity, the Detroit URC develops and conducts CBPR workshops with representatives from academic institutions, health departments, and community-based organizations. Drawing on the success of our partnerships in the Motor City, the Detroit URC is now offering a nationwide program called the CBPR Partnership Academy. The Academy is a year-long program for two-person teams comprised of a community member and academic researcher. Our community and academic trainers help guide the participant teams through the process of creating, implementing, and maintaining a real-life CBPR partnership in their community.
I learned more about how to conduct research, how to really go in and engage every member of the group.
I am super excited that it doesn't end with the week-long training, so the fact that we continue for a year and possibly beyond is very exciting.
The Detroit URC is building health equity victories, one CBPR partnership at a time. In collaboration with its partners, the center has helped to improve the health of Detroit residents, increase the influence of adults and youth in policy decision-making, enhance the physical environment and access to resources, increase grant dollars and research-related jobs, and improve trust between diverse communities. The Detroit URC Board hopes to expand the center's collaborative research by fostering and mentoring new CBPR partnerships with researchers from multiple universities, as well as new community organizations.
Because of the relationship and the partnership that we have with the scientists that are members of the Detroit URC, when I go to policymakers, I have two things that can help move policy. One is that I'm a constituent and that I vote for these folks. The other is that I have the backing of scientists.
Our relationship with the URC has been one that is phenomenal. We would not be the organization we are today without those relationships that we built, without the different programs that we've been able to initiate way beyond community health centers.
It's been an amazing experience, having a chance to co-author papers of research, having a chance to participate and bring community-based organizations to the table for interventions and things like that. It's been amazing.
Together, CBPR partnerships are changing the public health research paradigm. Research is more than conducting studies and publishing results. It's about transforming people's lives and communities. We welcome your partnership in the work. Visit our Get Involved webpage for specific ways you can engage with us.